Hey, good afternoon. This is Dr. Roman Schneider at the Ozark Chiropractic Clinic, and I'd like to welcome you to our weekly newsletter this week. We're going to continue talking about our functional medicine, and today we're going to talk a little bit more about heart disease, cardiovascular disease. Obviously, it's a big problem in this country. I want to share some statistics with you over some of the classes I've been taking. They said that heart disease claims 1 life every 30 seconds. That's what I wanted to say there. So it's affecting a lot of people a lot of times and stuff. They said that on average, one person will die every 40 seconds from cardiovascular disease. Let's see. Each year, an estimated 620,000 Americans have a coronary attack. Some have a recurrent attack, 150 have their first sign and things. Approximately every 34 seconds, one American has a coronary event, and approximately every 1 minute, in 23 seconds, an American will die from one. So we have a lot of things going on in there too, and such. The thing is that cardiovascular disease can be preventable and reversible. It can be treated. Oftentimes we think that once you're on it, you're on the drugs, you're on a path downward, there's no coming back, but you can do it in things. Causes of cardiovascular disease include things like your diet, so that's something you can change. Obesity, weight gain, we certainly can work on that and change that. Tobacco use, smoking, so we can work on that, not smoking. Hypertension, blood pressure, so there's things we can do to help lower that down and not always have to rely on medication for that. Diabetes mellitus, type 2, definitely. People who are on diabetes generally going to develop heart disease. It's just the way the pattern's going to go with how the sugar and the metabolism, the breakdown of things, and how heart disease will occur. So once you're in that flow, that's not a good cycle, so we need to break that. And then no regular exercise. One of the biggest things you can do, and it doesn't cost you a thing. So all these things have been documented, well proven, but they're just not utilized on a regular basis and such. We want to say that most people don't realize that it costs $1 million if you have a heart attack and to treat and to take care of that. That's a lot of money. And so people want to complain about diets or of cost of supplements or eating good foods. It doesn't cost nearly what a heart attack costs, and then all the damage into the quality of life and the change it's going to do to you. So what are some things you can do? Well, like we said, let's start talking about your diet. Let's start cleaning it up. Let's remove things, because they also did a study. They found that half the people who had heart attacks had normal cholesterol and normal LDL levels. So it doesn't always indicate that that's going to be a trigger and stuff. But what can we do to start changing our diets? We can charge by better foods, dark green leafy vegetables, good protein sources, good fats. We need those things. Water consumption there. Exercise. One of the best things you can do is regular exercise. Helps the body, helps stimulate the immune system, the nervous system, the heart system. Everything works better. Just getting out and walking to begin with. Doing weights, going into things. And those are things you can ask us as we go along, and we can help you with and help guide and tailor something specifically to your needs there. So doing that, quitting drinking, the smoking, all those things there. Getting off medications, changing your lifestyles, because those are things you can do. Sometimes there's a small bit of genetics in there, but that's a very small percentage. And here's the neat thing. When you start to change your genes, things you pass on to others will be affected, and they'll improve too. So if you pass on bad habits and things that your body's done, those things get inbred, and they're going to be passed on genetically. So you can change your genes. It's called epigenetics, whereas you change the expression how things work. And that's a really exciting field. I think more people are looking into that, not enough, but it's something that's very important out there. And then lastly, one of the most important things is good structural function. That means good nerve flow, and that's where chiropractic comes in, helping to keep those nerve channels open and working well. So those are some things to start looking at. But the best thing to do is just call us, talk to us, sit down and ask for an evaluation. What can we do to help you? We'll do your lab work. We'll look at that, and we'll come up with a plan to help you and see what needs to be addressed. But the biggest thing is don't wait. If you've had issues, if there's been problems, now's the time to look at it and to take action. Putting it off just makes the problems worse down the road. So I want to thank you all for your time and efforts. Remind you, we're doing our food drive this week. So any new patients donate canned goods to get their exam or x-rays. Anybody like to donate, please do. All goes to the DHS food banks for Thanksgiving and Christmas. But again, thank you for your time. As always, if you have questions, call me at 479-667-5053. Check out the website, ozarkchiropractic.com. Like us on Facebook. And until next time, have a great day. Thank you very much.